So let us talk about dysplasia. What do you mean by dysplasia? And what do you mean by metaplasia? Metaplasia. So dysplasia means it has atypical features. Atypia. Features of atypia. Atypia means आपके जो carcinoma cells, all the cells which are carcinogenic, which are malignant, have the features of dysplasia. So we used to study when we were in MBBS, we used to study in our pathology that dysplasia is composed of some of the features in the cells. Number one, the nucleus increases in size. The nucleus increases. So there is raised nucleocytoplasmic ratio. Raised nucleocytoplasmic ratio, number one. Number two, there is hyperchromatism. Hyperchromatism. Hyperchromatism also means that the nucleus is increasing in size. Okay, so number two is hyperchromatism. Third is there is loss of basal polarity. Loss of basal polarity. Okay, so loss of basal polarity. Basically, the cells, the basement membrane, the cells will have their nucleus towards the basal part of the cells. But in case of malignant cells, what happens? Few of the cells will have their nucleus up and few of the cells will have their nucleus below. So there is loss of basal polarity. Whereas if you find normal ectocervix and endocervical cells, then all will have their nucleus small and they will be concentrated towards the lower part of the cell. So this is how there is loss of basal polarity. Number four, there will be other features like there will be mitotic figures. Now, what do you mean by mitotic figures? Mitotic figures are when the cells are visualized under the microscope. If there is division of the cells, then you find cell mitosis. Okay, mitosis. So there will be some. Whenever there is mitosis, the chromosomes divides into chromatids. So you have mitotic figures which you will find in the dividing cells. So presence of these mitotic figures will also help us in differentiating whether the cells are having malignant features or not. Okay, so these are the things. And the number five is anisopoikilocytosis. Anisopoikilocytosis. So an means unequal. Okay, iso and poikilo. Iso means equal size and poikilo means equal shape. So there is neither equal size of the cells nor equal shape of the cells. So all cells in cancer, in malignancy, will have variety of sizes and shapes. So these are the five features which help in defining dysplastic cells. So whenever you find dysplastic cells, be it in your cytology sample, that is pap smear, or your histopathology sample, that is cervical biopsy, we screen the patient to have cancer. We screen the patient to have cancer and then we go for further diagnostic tests to determine what the cancer is. Coming to the next terminology, which is metaplasia. So what actually is metaplasia? Metaplasia means one mature cell lineage is being converted to another mature cell lineage. This is very important. So one mature cell lineage gets converted to another mature cell lineage. It means suppose stratified squamous epithelium. There is stratified squamous epithelium. It got changed into columnar epithelium. It got changed to columnar epithelium. So this will be called as metaplasia. Similarly, columnar epithelium can get changed to stratified squamous epithelium. So these are all mature types of cell lineage, and this is called metaplasia. Metaplasia is not cancer, mind you. Metaplasia is not at all cancer. It is just the transformation of one type of cell lineage to the other type of cell lineage. Okay, so very clear to all of you. So this is all about metaplasia. Metaplasia is very much different from dysplasia. While dysplasia is something which is khatarnak, it is not good and is not expected. Metaplasia is expected at certain point of time. Like when the transformation zone or the squamous-columnar junction is shifting inside and outside, the cells of the transformation zone will get converted. Few of the columnar cells will get converted to stratified squamous cells, and few of the stratified squamous cells will get converted into columnar cells, depending upon what is the wear and tear of the cervix and what is the level of estrogen exposure of the cervix.